Well, you are listening to Speak Up and Stay Alive, Patient Safety Radio, and I am your hostess, Pat Rulo, with a topic and a guest that, believe it or not, is a first on our program. Most of the time, we talk about healthcare and hospital hazards from the patient, family member, doctor, or nurse perspective, but what about the first responders, the emergency medical service people, the 911 folks? Well, today I have quite the expert with us. He is Mike Taigman. Mike has spent the last 40 years in emergency medical services. He started as a volunteer in Castle Rock, Colorado, and has worked as an EMT, a paramedic, flight medic, field training officer, quality improvement manager, and general manager in 911 EMS systems across the United States. He is an associate professor for the graduate program in emergency health services management at the University of Maryland, Baltimore County. For 12 years, he did full-time consulting, working with EMS systems in 48 of the U.S. states, most of the Canadian provinces, Europe, Israel, Palestine, Australia, and Tasmania. Mike has published over 500 articles and spoken at hundreds of conferences on topics ranging from change management and street survival to electrocardiography and the disease of alcoholism. He has a master's in organizational systems from Saybrook University and is a certified improvement advisor with the Institute for Healthcare Improvement. Can we ask for anything more? Welcome to the show, Mike.
Thank you very much, Pat.
Oh, such a thrill to have you here today. Well, we talk quite a bit about cross-contamination on this program, and on occasion, I've spoken about the ambulance ride, guessing that this might be a place that is hard to clean and might harbor infection-causing germs and bacteria. Is that true, or what other places or times during an emergency encounter is cross-contamination a concern?
Certainly, like any healthcare setting, ambulances and the equipment that are used by paramedics, either from fire department or ambulance services, have the potential to contain viruses or bacteria from other patients that have been cared for if they're not properly cleaned.
So the ambulance ride is the beginning, and then once we get into the emergency room, is there concern there as well?
Absolutely.
All right. Well, what can the everyday person do then to prepare themselves and even perhaps prepare their home for a potential emergency visit, say a 911 call? So I guess what I'm looking for is, if the person is alone and unconscious, how can you accurately diagnose and treat them without knowing their history or medications or even their end of life or resuscitation preferences?
Certainly it is challenging when patients are unable to communicate. Then you have to rely on basic signs and symptoms and the things that we find in their home. You'll look around to see if there are medications or if there is one of the vial of life attached to their refrigerator or in their freezer that may give you some medication information, some past medical history information. One of the challenges is that those are notoriously difficult to keep up. People will get those and put down their whole list of medications and put it in the refrigerator and then change physicians and have different diagnoses and come off medications and go on new medications and forget to update their list. It certainly is helpful to have that information. It's not essential because you can pretty much figure out the basics of vital emergency medical care without that information. The one exception being do not resuscitate or end of life kind of requests and orders. If those aren't available, the presumption by the paramedics is that a person wants to live until proven otherwise.
Interesting. So let's say you have a person that already is compromised. They have a compromised health situation and they know that they're fragile. Say it might be an older person. It might be helpful then if they just did have a list of their allergies and maybe their advanced directives somewhere. Is there a singular place that should be where the emergency response folks know where to look?
You know, the vial of life, historically, you put a little sign on the front door that there is one inside, and it tends to go on or in the refrigerator is the most common place for people to have that. If somebody is bedbound and is in their bedroom, having their medications all in one box next to their bed is another common way to deal with things, and having the paperwork included there as well.
Right. I just think it's important to prepare, especially for folks who know that they have medical problems and may live alone, right?
Absolutely.
Right.
Absolutely. And on the topic of preparation, one of the things I will put a pitch out there for is that I believe everybody should learn how to do compression-only CPR. Mm-hmm. I believe it is actually a life skill. It's like riding a bicycle or knowing how to swim or knowing which fork to use when you're at a fancy restaurant. Everyone should be able to know how to do compression-only CPR, and if everyone in our society and communities knew how to do that, a larger percentage of people would be resuscitated and able to go home from the hospital after they suffer a cardiac arrest.
Oh, excellent advice. Thank you for mentioning that. I didn't even think of that. Excellent. When I was thinking, because the EMS deal with fast-moving and many times life and death situations, how do you still manage to treat the person as a whole person? And when in such a situation, do you keep the patient engagement, patient experience in mind, or is your sole goal to keep the person alive?
It's a both and. The reality is most 911 calls are not truly life or death situations. Mm-hmm. And most of the patients that we care for are awake and able to interact and able to participate in their healthcare choices. When I show up on a scene, I always start by making eye contact, introducing myself, asking the person their name, asking what it is that happened that caused them to reach out for help today, mm-hmm. and then really listen. And you're listening for clinical diagnostic criteria about the nature of their pain or their difficulty breathing or whatever it might happen to be, but you're also listening for their fears, issues related to family members. You know, many people, particularly people who live alone, worry about their pets.
Yes.
They worry about the safety of their household and their belongings. They worry if somebody's going to see them taken off to the hospital and maybe come in and steal some of their belongings from their house. There are a lot of concerns that people may have that if you kind of listen between the lines, you may be able to recognize and help address while you're addressing whatever clinical issue brought you to the scene in the first place.
Wow. So not just a clinical expertise, almost a psychological and an emotional and empathetic type of a person as well, right?
Absolutely.
Yeah. Now, I was wondering about dangerous patients. I'm sure you come across violent or intoxicated patients, or even the people around them who might be unruly. Just how do you deal with that?
Well, as you develop experience in EMS, you certainly do run across situations, most often involving people who are under the influence of whether it is a mind-altering substance, most commonly alcohol, to tell you the truth, or they may have a low blood sugar state or something that has caused their oxygen level in their system to be low, all of which can make you irritated, cranky, and potentially violent. Mm-hmm. So you learn how to recognize the signs that somebody might be violent. You position yourself in such a way that if somebody were to strike out, that you can block and protect yourself from getting hurt. You learn how to, as part of your examination, to determine if there may be a weapon hidden on them. And you learn how to remove that without them necessarily being aware of it to improve your safety.
Wow. Well, I have a great respect for what you do because it's multifaceted.
It is multifaceted, and that's what keeps it engaging. Even after 40 years, the next 911 call you show up on is going to be a different person in a different house with a different set of complaints than anything else you've ever dealt with before. So it's always fresh and new, and if you like people and you have an innate compassion and curiosity, it's a pretty good way to make a living.
Oh, I'm sure, and very rewarding. You have to think on your feet, but the outcome for people, I mean, you're their lifeline at that point in time, so what an important person you are when you walk in.
Well, we feel that the patient's the most important person and we're there to serve them.
I know, but they probably think you're the most important person. You're just like, oh my gosh, thank you for arriving, and they look to you as the person that's going to help them.
Sometimes it becomes a little mutual admiration society.
I bet. Well, now, with Ebola in the news, can we talk a little bit about EMS and the preparedness? Have you gotten any conversations or training on that?
Absolutely. EMS systems throughout the world, and certainly throughout the United States, have taken a number of extra steps to be prepared for Ebola. We already have things in place to protect ourselves and our patients from other fluid-borne diseases like hepatitis or HIV, those types of things, other fluid-borne illnesses like C. diff or MRSA or the flu. Those things are all things that we deal with on a much more frequent basis. And the precautions when dealing with an Ebola patient are essentially the same. They're just heightened a little bit because of the mortality rates associated with Ebola. And when somebody is at the height of their disease process with Ebola, the virus tends to be available on their skin and throughout other bodily fluids, so it is perceived to be more of a contagion.
Very interesting times for you.
Yes, they are.
I'm sure. And then I was even thinking, what about terrorism training? I know we're getting off in a crazy subject, but I would imagine that's something you have to be thinking about as well.
Absolutely. There's training involved in bioterrorism and chemical terrorism, multiple shooter incidents. Every one of those things you see in the news, there are EMS providers involved at some level.
Right, right. All right. Well, so much to know about this topic, and we've never really gone there before, so I think you're giving us a little thumbnail sketch of that. Is there anything else missing that you'd like to share, or anything that you do that you're really passionate about that you'd like to share with us?
One of the things that we certainly notice is that a number of the things that cause 911 to be activated are people with chronic diseases such as asthma, diabetes, epilepsy, and there are a number of things that if patients would take the time to educate themselves on self-care, and set up systems for themselves to remind themselves to take their medication, make sure they know how to use their medications properly. It's very common with asthma patients to not understand the difference between maintenance medications and rescue medications and how you use each type of inhaler. Pushing your physician, your nurse practitioner, your PA, your primary care providers to spend the time to teach you how to effectively care for yourself, you're less likely to end up in a health situation that requires 911 to be called.
That is excellent advice. Absolutely. To be proactive and to be an empowered patient and know what it is that you need to know about your own health and monitor that and manage that, and it'll keep you away from you, right?
Absolutely. And if there's any doubt or any concern, a situation arises, we're here for you all over the country.
This is great. Well, now, where can we find out more about you and what you do?
Our corporate website is www.amr.net. That lets you know about American Medical Response. It also has links to our parent company, Envision Healthcare. And my personal website is www.emsleader.com.
Wow, and you are an EMS leader. What a pleasure to have you with us today, and this has been very enlightening for me, and I'm sure it will give all of us reason to think ahead and prepare. So thanks so much for sharing this with us today.
Thank you very much for inviting me. This is fun. I like your style.
Thank you. I appreciate that.